again, and we will get cracking. So hi everyone, I'm Una Morrison. I'm part of the Dublin Cycling Campaign Exec Board and or committee, and we're delighted to have you all here this evening. We'll be recording tonight's webinar, like I said, for playback, and we will be saving our questions till the end. Mairéad just briefly has a couple of quick announcements from the Dublin Cycling Campaign, and then we'll get cracking with our first speaker, who will be Dr. Colm Byrne, who's a consultant geriatrician in the Manor Hospital and a member of Doctors for the Environment. So Mairéad, over to you.
Hi. First of all, today is the first day of the UN Global Road Safety Week 2021, and the focus of this year's week is on 30-kilometre speed limits in built-up areas where vulnerable road users like pedestrians and cyclists share road space with motor vehicles. I'll put up links in a minute to the UN Global Road Safety Week, and I'll put up links to a thing that Love 30 is organising. We're organising a photo competition. We want you to take a photograph somewhere where you want a 30-kilometre speed limit, and we want you to print off our poster and take a photograph of the poster with it so that we know you've done the real thing for this week. And then if you post that up on Twitter and tag us, we'll then judge, and there will be prizes for the competition. So the full details are on the Love 30 site, and I'll give that to you in a few minutes. The other thing I want to tell you about is that there is a public consultation going on at the moment about climate change, and the government is looking for observations from the general public and from expert bodies on what they think should be in the climate plan. And again, I'll put the link up in a minute, but the idea is that you click into this link and you fill up a questionnaire and you give your view of what needs to be done for Ireland to achieve its climate targets. And the important thing about this is the deadline is tomorrow. So sometime between now and tomorrow evening, you've got to get into this and give your view. And I think it's very important. We should all give a view on that. So that's it from me. I'll put up the links in a second. Thanks.
Thanks, Mairéad. And I have one last announcement on behalf of the campaign. Our next public meeting will be probably around the 14th of June, but the topic will be on cycling holidays in Ireland. So apt for this staycation year. So if you're interested in bringing your bike on holiday and planning cycling holidays, please come along and we'll have a nice fun chat about that. So now we can move on to our topic for the evening, which is about air quality and public health, and also what active transport has an impact on that. I think this is a really interesting topic, and for me, it's not something I know an awful lot about, and I'm really interested in hearing our speakers tonight. I've noticed over the past couple of years as I've been a cyclist that I'm, noticing the fumes more. I'm a cargo bike cyclist with kids in the front, so I'm conscious of what they're breathing. And I've read about it with interest about the London low traffic network and how that's impacted their air quality, and how some of those things have been sponsored by the NHS and how that's impacted public health. So I think this is a really interesting session for us this evening, and particularly because over the past year we're all aware more about ventilation and airborne things. I think it's really apt, and people are, the air we breathe is something that we don't see, and we're not necessarily as conscious of it because we all breathe without really thinking about it. But I think what we put into our bodies in the air we breathe is really important to hear. So we have three really interesting professional experts this evening. Like I mentioned, we have Colm Henry kicking things off, and then we'll chat to Patrick Kenny from the EPA, from the Ambient Air Quality Unit, and Francesco Pilla, who is a associate professor in UCD in the School of Architecture. And finally, Robert Burns on how, from Rathdown, Director of Infrastructure and Climate Change, also known as Mr. Coastal Mobility Route. And I look forward to hearing from you all. So like I mentioned earlier, please save your questions to the end or fire them into the chat. You'll see that little red notification button where Connor is throwing in all those links we've mentioned. So please throw in some questions or into the chat or into the Q&A, and we'll get cracking. So Colm, over to you first. And thank you everyone for being here.
Thank you very much. Now, just going to open.
So it's the speaker view.
Sorry.
No problem. Nothing like a live demo, you know.
It was working then.
Perfect.
Okay.
Great.
Great. So thank you very much for inviting me to speak today. So I'm a geriatrician and a general physician in the Mater Hospital, and I also am a member of Irish Doctors for the Environment, who are a group of medical professionals who we campaign and are active in climate issues, including active travel and air pollution. And I've just finished my doctorate in studying air pollution and stroke. So that's where I'm coming from. So air pollution and active travel is obviously highly connected. We are in a kind of deluge now of cars and an environment where cars dominate, and 3/4 of journeys in Ireland are now taken by car, with only 13.5% of journeys consisting of walking or cycling, and even of journeys that are under 2 kilometers, only 40% are actually done by walking and cycling. So we have this car built environment that comes with a lot of consequences, and a lot of consequences for health, which I'm going to go through now in this presentation. So air pollution obviously is one of the major issues, and transport is probably number 2 only to residential solid fuel burning in terms of being a source of air pollution in Ireland. And the 2 main pollutants that it produces are particulate matter, which are kind of fine particles that are suspended in the air, and I'm sure Pat will talk about that later, and also nitrogen dioxides, which are produced by cars, predominantly diesel cars. So these have effects on the body, and in particular those small little particles that are suspended in the air. These have effects on everyone, and they affect the body in a few different ways. They can directly affect the lungs when you inhale them into the lungs and cause inflammation in the lungs that can both affect the lungs and then spill over into the bloodstream. What can also happen is that it can cross over directly into the bloodstream through the lungs or through the nose, and affect the organs directly by being carried along in the blood. They can also actually even directly go into the central nervous system through your nose and through the olfactory nerve, and can cause effects in the nervous system directly as well, and these effects can, it affects pretty much every single organ in the body, and from a cardiovascular point of view, it can increase your risk of diabetes, of obesity, of blood pressure, of atherosclerosis, and so on. So as Una mentioned earlier, we unthinkingly just inhale these pollutants as we go around our daily business, but they have been shown to have direct and indirect effects on the body and on diseases. And in 2018, the European Environment Agency calculated that EU-wide, there were over 450,000 premature deaths in the EU due to poor air quality. In Ireland, air pollution is estimated to have caused 1,410 premature deaths, which equated to 363 years of life lost per 100,000 people. So it's quite a significant effect. If you think about the number of people that have been affected by COVID over the last year, there are high numbers as well also being affected by air pollution, which is something that happens every year, and so it is something that we should be keeping in mind. The clinical effects of air pollution are many. Overall mortality has been shown to be affected. So, and one of the interesting things about that is, as you can see in this graph here, when you're at lower levels of air pollution, it has a greater effect on mortality. Which means that there's no safe level of air pollution. So sometimes, there's targets, there's EU targets and WHO targets of air pollution levels, but there is actually no real safe level of air pollution, and we should always try to get down to the lowest possible air pollution level, because even at low levels, there is a benefit to reducing down air pollution. But it also has an effect not just on mortality, but on morbidity or diseases. So cardiovascular diseases like heart failure, heart attacks, and so on. Strokes are also affected. Respiratory diseases like asthma and chronic obstructive pulmonary disease or emphysema. And then COVID has also been linked with air pollution. Dementia, Parkinson's disease, and even other diseases like rheumatoid arthritis or diabetes or kidney disease as well have also been affected. So there's a high level of high number of diseases affected. We published a paper last year showing effects in Ireland, in Dublin, of air pollution on the risk of your short-term risk of having a stroke, and we showed an association between NO2 and small particles in the air, PM2.5, and stroke during winter. Moving on, so our green spaces also have a big impact on us and in our and on our health. And this is a really interesting study that came out of the SRI a couple of years ago, looking at older adults in Ireland, and showed that if you've got a small amount of green space in your area, that you're at a higher risk of obesity. As you came down to the third quintile, or into the middle, your risk of obesity dropped down. But then, as you had more green space then in urban areas, your risk of obesity increased. And then when you're in a rural setting, your risk of obesity also increased then as well. And the reason for this is the authors estimated that it's actually the quality of your green space that actually matters. So how good your green space is around you and how accessible it is. And I also think that it also matters if you can get out and get to it in an active way. So if you have to drive to it, that obviously has a bigger effect. Noise pollution is also a major issue, and I think sometimes we forget about that as well when it comes to roads. Noise pollution is also a major issue and is responsible for 18,000 premature deaths in Europe. And this is a map from DPA, and you can see where noise pollution is going to affect you. And so we have this inactivity crisis, and there's multiple diseases that are affected by it. What are the benefits? The European Cycling Federation came out and have said that 18,000 lives have been saved due to cycling in the EU. There's 74 billion euro per year saved. Concentration levels of children are higher in those that are cycling rather than those that are driven, and there's fewer sick days for employees as well. but in those is cycle to work rather than drive. There's only about 15 to 20 minutes a day required to start to see the benefits of active travel. So you don't have to do a whole lot. And another interesting study showed cycling commuters in Copenhagen were 40% less likely to die from any cause compared to other commuters over a 15-year period. And active travel also helps our air quality. So the low traffic networks that Una mentioned earlier, they have been shown to reduce air pollution in London. And combining clean air zones, school streets, and low traffic networks have been shown to reduce air pollution exposure in everyone, and not just school children. So that was a kind of a brief flying tour through some of the health effects of active travel. And if you'd like to follow Irish Doctors for Environment, that's our Twitter handle there. Thank you very much.
Thanks a million, Colm. Glad to see my assumptions were correct that we talked about earlier. And I'm frankly a little bit horrified by some of those stats and terrified. So I will be using my bike even more. So with that, I'm going to pass on to Patrick Kenny. As I mentioned, he's part of the EPA Ambient Air Quality Unit, and he can tell us a little bit more about what the air we're breathing is like.
Thank you very much. And yes, indeed, I'm going to go through air quality monitoring in Ireland. And just to say at the very start that if I haven't covered something that you'd like to hear me talk about, or if I've moved by it very quickly and you want me to cover it in some more, please do put in a question into the chat. I'm largely going to be focusing on transport and transport-related pollutants and the overall monitoring network, but just concentrating very much on those. And you hear me talking a lot about nitrogen dioxide, but I will also look to talk somewhere along the way about PM 2.5, those being the two major pollutants of concern in Ireland. So if you could go on to the next slide there, please. So I'm going to go through the National Ambient Air Quality Monitoring Programme, which has been running since 2017. It had three major aims: to increase the amount of monitoring, increase our capacity and capability for modelling, and do a lot more when it comes to citizen science. Those are the three main pillars. So in citizen science, we're going to talk about Globe Schools, Clean Air Together, which is a major project coming to Dublin this year, and Life Emerald. And that little map you can see in the corner is air quality in Dublin, nitrogen dioxide as modelled by ourselves and released in a report in 2019. And the areas in red are areas that are modelled to be in exceedance of the European annual average limit value. If you could go on to the next slide again, please. Thank you. So why did we put out a National Ambient Air Quality Monitoring Programme? So for the very first time, this placed air quality monitoring in Ireland on a statutory footing. It wasn't that way before. And the main aim was to provide more comprehensive data, make it more accessible, and hopefully start to engage the public with that data. So thank you very much, Dublin Cycling Campaign, for the opportunity to talk here today. And you can see there what was proposed. As I say again, more monitoring, some more modelling, and bringing in citizen science. And next slide. So what have we done so far? On the monitoring, we started out, and I have some more slides that talk about this in more colourful detail in a minute. We started out with a 29 station network that met the minimum criteria of the European CAFE, or Clean Air for Europe directive. And we are currently now at 29. So January 2017, sorry, oh God, good God. January 2017, we were at 29. At the moment, we're at 92. And we're currently heading for 110. And we would really like to thank all of our partners for their assistance with that, a whole range of local authorities and other public bodies who've come on board with us to make this happen, because we certainly didn't do all of this all on our own. Modelling and forecasting, what we said we do is we would work towards having an air quality forecast in order to allow citizens to make choices about their activities up to 2 days into the future, and that we'd expand what we had available out to the public for air quality modelling in general. And in citizen science and citizen engagement, that just to say that we saw that it was one of the pillars of that program, but we really saw this adding the extra value to the entire program, that we could have a wonderfully expanded network and a whole load of modeling and forecasting products available to the public. But if they remain completely unaware of it and unengaged with it, then really the state wouldn't be getting full value for this investment that it has put in over the last few years. Next slide, please. So this is the way our network used to look. This is January 2017. It met the minimum requirements of the CAFE directive. It was a network that was built kind of coming out of the Great Recession from 08, 09. And a decision was made from EPA to look for the money from government. And thankfully, the then minister and the government gave us that money to roll out that program. So that's where we were. If you click again, it'll go to where we are right now. So this is the current national network. Now, this actually isn't even every station. I'm not including the third layer, which is our local monitoring network. So you can see there, we're currently at 92. But we've also done along the way, and hopefully some of you have engaged with these products. We have a new website, airquality.ie. You can also get into all of these through epa.ie. We have a Twitter feed that tweets twice a day. This is all linked into our air quality index for health, which is AQIH, that you can see there on the right-hand side, in order to make all of this as understandable as possible for the Irish public, from green through to purple. And we also have improved our dashboard. This is the current version of the dashboard. It's been through about 5 iterations to get here. It's now dynamic, it's now interactive. You can scroll backwards, you can scroll forwards. We've moved to what's called a station-based index, so it colors in the dot on the location of the station. And we're now very much in line with our European peers, and that was the whole aim of the program. It also has greatly increased functionality and hopefully accessibility. But look, we ain't going to stop there. We know it's probably not perfect. We're very interested in feedback from all parties, including everyone who's listening here this evening. If you're looking for something else on this, or you'd like it to be able to do something else, we will take that on board. I would hope that I can say that we've taken on board a lot of what we've gotten down through the years. We mightn't be able to do it in the next version, but if we can't do it then, we look to bring it on board for future versions, because we're not stopping evolving this as a product. Next slide, please. This is Dublin. This is the Dublin monitoring network. It's subset in there. In the greater Dublin area, there are 31 monitoring stations, and there's 7 more on the way. So I won't start name checking them, but there's 7 more to add to that. So we will be up to 38 in the greater Dublin area. And next slide, please. This again is that modeled map. So for the first time, the EPA has put out modeled map products. This was a modeled map of exceedances in Dublin. And if you go on to the next slide again there, please. So this was put out in the report Urban Environmental Indicators, which also all of these reports and all of this information is on epa.ie. As I said, the actual interactive products are also on airquality.ie. So this nitrogen dioxide modeling, which also linked through to a thing called tube studies, it indicated an exceedance in Dublin. Unfortunately, that has proven to be the case. For the year 2019, Dublin did exceed the EU annual average limit value for nitrogen dioxide, which is a traffic-derived pollutant at St. John's Road West Station in Dublin, just by Houston Station. And we are in exceedance, and there is therefore a requirement for an action plan, an air quality plan for Dublin, which the 4 Dublin local authorities, in cooperation with EPA and the Department of the Environment, are currently working on. You've heard me talking a lot about nitrogen dioxide. As I said, it is one of the 2 major problematic pollutants from a health perspective in Ireland. The other one's PM2.5. From a health perspective, PM2.5 is actually the worst of the 2. Of those greater than 1,300 premature deaths in Ireland every year, the bulk of those by far is actually from PM2.5, and the dominant source for PM2.5 is domestic solid fuel burning. But as I say, I am very much focusing on traffic and the traffic pollutant nitrogen dioxide this evening, but just not to lose sight of the fact that the major pollutant of concern from a health perspective is PM2.5, and the dominant source is how we heat our homes. And I know there's a lot going on at government level with that at the moment. Next slide again there, please. So again, this is just a zoom in on the streets of Dublin from that modelled report. The areas in red are indicating exceedance of the EU annual limit value for nitrogen dioxide. And next slide, please. So other things that are going on then, those citizen science projects. We have two major ones that are running and a lot of smaller things that we're involved in, but Globe Schools has been running for the last number of years. Again, these are both with our partners on Taishke, who have been brilliant partners for us to work with on all of these. So Globe Schools, so far, 96 schools and over 3,000 measurements. I think any school that's ever got involved with this has walked away very, very happy with the engagement and have found it a really rewarding project to be involved in. If you're interested in your kid's school getting involved in this, please do talk to the school and look to get the school to apply to us in EPA. They can email me, they can email some of my other colleagues in our citizen science unit, and that's how you get involved in Globe Schools. You contact us. You can also contact the educational unit in Taishke. The other project I really want to flag is Clean Air Together. Clean Air Together is going to be the biggest citizen science project we will ever have done in Ireland. Certainly the EPA will have done. It's going out in Dublin. We've already done a pilot. It's November 2021. We want to put out 1,200 nitrogen dioxide tubes right across the city. We want a massive involvement. We want good coverage right across the entire city. This is going to assist us in getting far more detail about the air quality situation from a nitrogen dioxide perspective right across. And it's going to help us with our modelling. And we're also hoping to use this as a means to engage far more of the people in Dublin about air quality, transport and air quality, and hopefully the wider issue. And that's happening November 2021. Hopefully you'll be hearing a lot more about that between now and then. Life Emerald, we've secured EU co-funding for a three-year modelling project, by the end of which we will have that 48-hour forecast that we talked about available out to the Irish public, which we see as a real game changer. For the first time, you'll be able to go on our website and hopefully through other channels, you'll be able to get an indication what the air quality is going to be into the future and be able to make informed decisions about your choices. Particularly relevant, possibly for those of us who are particularly impacted on by poor air quality, but for everybody. It's also going to provide what's called a nowcast. You saw the dots on the map a little bit further back. What Emerald is going to do is it's going to color in between those dots on an hourly basis using a modeled product. So again, we'll be able to give on an hourly basis the air quality everywhere, right across the island. Equally, it's also going to provide historical maps, so looking back in time. So similar to that product that you saw for Dublin that we've already done, we're going to be able to do that for the entire country. Now, more to that, this year, that map you saw a little bit earlier is the one from that report we put out in 2019. That's based on 2015 climate data. We've also then updated that for 2017. That went out in our State of the Environment report last year. And we're further updating that this year. We're going to have maps out for 2018 and 2019. And adding to that, because, you know, we're a national body, it's not just Dublin. We're also going to do the 4 other cities in the same level of detail that we've done Dublin in, and we're going to do the entirety of the rest of the state this year as a map product. Now, the rest of the country is not going to be the same level of granular detail as Dublin and the cities, but for the first time, we're going to have a map of the entirety of Ireland out, hopefully by the end of this year. COVID is posing us some issues, but we hope to still get that out by the end of this year. If I could do one more promo, it's for the EPA National Air event. It's our annual event. It's Ireland's annual air conference. We've had some really brilliant and high-level speakers down through the years, and we're hoping to do so again this year. It's online, it's moved online, it's greatly expanded down through the years, with last year the move online being really a very good move for us. We got far more people there. It's free. Anyone can register. Please, if you're interested in air quality, you can log on for just half an hour to hear our high-level speaker or hear whoever from the department if you just want to. But we'll be sending out the links to that as well. And the last thing I'm just going to say is, obviously, you've seen the video in the Google AirView streetcar, and apologies, I've gone over time. We are linked into that project. And again, we're very much looking forward to seeing what's going to come out of that and getting all of that data from those runs around the city. I'll stop there, and apologies for going over.
Well, it's great to hear your enthusiasm, Patrick. Thanks a million, and incredible to hear about that levels of data. I'll certainly be going for a poke and checking it all out. And if you send us on all those details about those upcoming events in November, we will do our best to share the news with our followers. So thank you very much. So following on from that, from what we're doing on a national level, I'd like to invite Francesco Pilla from the UCD School of Architecture to talk to us a little bit more about his work.
Hello, good evening. So my name is Francesco Pilla. I'm an associate professor in University College Dublin, Well, my work focuses on making cities more sustainable through innovation, technology, and citizen engagement. So actually, it's about citizen engagement. I'll be talking about this evening. In specific, I'll be talking about one of my European projects, which is called Recount, a project funded by the European Commission, which started in December 2017 and will finish November this year. We have 6 partners, a good mix between academics, companies and NGOs. And the focus of this project, this is a pure citizen science project. So the focus is actually empowering citizens to do something about, in this case, about traffic, local traffic. So what we are doing is that, probably you see yourself whenever there is an issue or related to traffic in your local community, citizens just tend to become very vocal, complaining on social media, giving out to the local authorities. But at the end of the day, they are just complaints. There is not enough proof, evidence to sustain those kind of complaints. So this is what this project is about, basically giving citizens not only the technological tools to provide this evidence for their complaints about traffic, but also providing them with skills to make sense of the data that they are collecting. So what we are doing, we are basically, as I said before, empowering local communities with technology and skills to monitor traffic and air pollution in a local area. So we have 6 pilots around Europe. Dublin is one, the others are Madrid, Barcelona, Leuven, Ljubljana, and Cardiff. So, we are in all the pilots, we are, as I said, we are focusing on traffic, but the pilots between themselves are slightly different. Today I'll just talk about the pilot in Dublin, as we have limited time. Otherwise, as you know yourself, I'm an academic. I'll be talking the whole evening. Okay. So the Dublin pilot, when we proposed this project to the European Commission, originally we were planning to focus only on a very limited area in Dublin, in specific on Ringsend. This is because whenever you have to work with sensors and with citizens, there are an awful lot of challenges related to the technology itself, but also to finding citizens that are willing to work with that kind of technology. But said that, when we started the engagement campaign in Ringsend, we got a lot of interest from several local communities around Dublin. Then it kind of went viral and started to engage with communities in Fingal, in Laoghaire, in South Dublin, in Limerick, in Cork, and so on. So we started with the first deployment that I think I sent around during the last lockdown. I shipped over around 250 sensors to citizens around Dublin. Then we started, sent the sensors around, we started the engagement with the citizens, and then we figured out that despite the fact that we engaged this high number of citizens in the monitoring campaign all over Ireland, the issues were quite similar. So I would say around 90% of the citizens that we engaged were concerned about health and safety and livability in the local community, especially in specific around the schools. So this is why then we decided to run a second campaign focusing specifically on citizen science activities in schools. So monitoring traffic and air pollution in several schools around Dublin and around Ireland, in the hope that that will provide evidence for the schools to apply for more sustainable infrastructure around the place, so reduce the traffic levels, but also use the data to engage the kids in a conversation about why there are such high levels of air pollution around their school. And more than likely, the answer is high volume of traffic. So these are the sensors that we are using as part of this project. The one that you see on the left is a traffic sensor, is a camera-based sensor, which sounds very creepy, but I can guarantee that is all GDPR compliant. We went through the scrutiny of the European Commission. So it is a camera-based sensor. It counts cars, pedestrian, bikes, and heavy vehicles. What it does is that it does the counting on the edge, so on the device itself, and transmits only the numbers. So the images are deleted straight away. The one you see on the right is a low-cost air pollution for particulate matter, PM1, 2.5, and 10. And well, it was developed as part of another one of my Horizon 2020 called Icescape. So I'll spend a few words about the citizen science framework that we are using for this project. So, well, the citizen science framework that we're using for our project starts with the engagement of a local community. So talking to the local community, understanding what it is that is of concern to them, in specific related to traffic. So it is about health and safety around schools. It is about post-connect. It is about the local community used as a rat race. But it is all about basically empathizing with the local community to understand what it is that they want to measure. Why is that this problem is of such concern to them, this traffic-related issue. This is because at the end of the day, this is a citizen science project. It's not just about me collecting an awful lot of data to write a shiny journal paper. It is about engaging with the citizens, giving them the technology, the tools to solve themselves the problem that it's affecting them. Okay.
1 minute left, Francesco.
Okay, perfect. So the second step is related to co-designing the monitoring campaign. So see where we deploy the sensor, who is going to host them, and so on. The third step is about collecting the data itself. But then I think the most critical step is actually providing the citizens with tools to make sense themselves of the data. Because at the end of the day, once the project is over, the sensor, if they are not able to make sense of the data themselves, is just a little tool that potentially will get dismissed very soon. So we are producing very straightforward analytical tools so the citizen can make actually sense of the data themselves and potentially use to package up the data as an evidence for the complaint for more sustainable mobility in their local area. So basically going from scoping the problem to a policy proposal at the very end of the project. So that's where we are aiming at, and that's hopefully what you will see in the news in the next few months. Okay, and that's all for me. Thank you so much.
Thanks a million, Francesco, and bang on time. Really interesting, and I think it's particularly interesting how the focus has been on schools, and we know from the work they do with Dantashka and green flags and all of these kinds of things that environmentalism is. And looking at the quality of the school environment is so important. And we know that kids motivate change in adults as well. So hopefully that will make a bigger impact, not just in the schools, but in their families and communities. So thank you so much. Now, our final speaker for this evening is Robert Byrne, Director of Infrastructure and Climate Change with Dublin Area Rathdown County Council. If I've got that right. And he's going to chat to us a little bit more. So over to you, Robert. And then after Robert, we'll take Q&A as well. I see we're now up to 68 people here on the webinar. So thanks a million, everyone, for joining. We're delighted to have you.
Okay. Hi, everybody. I'll just go back to the start. Firstly, thanks to Dublin Cycling Campaign for inviting me here this evening. It's a pleasure. I'm really interested to hear what the other three speakers had to say. So I was trying to second guess and make sure that I didn't overlap. I think they should complement one another. So I think Una's introduce me. I think probably most of you know who I am anyway. Been involved in a lot of mobility projects, infrastructure projects generally. I suppose this whole area of active travel is something that I have got quite a significant interest in. And I'm going to talk about how active travel probably links in with air quality and some of the other environmental pressures that there are. So I've probably taken a slightly different slant on it to the others, which I think is fine, because I'm working at it or looking at it as a practitioner. I'm looking at it as someone who has to implement this. And I'm trying to understand it and see how I can use it. So just going to go through those 4 key areas there. So I know it's been referred to during the earlier presentation, but it's important to look at the wider context. There is a nexus between the climate issues, environment and health issues. So obviously we're well aware of climate action, CO2 related emissions. Local authorities have climate action plans in place. So in a lot of ways, almost by proxy, we are dealing with air pollution through climate action. So reducing greenhouse gas emissions also can have the impact of reducing air pollution. In terms of environment, we also need to consider noise and air. Noise is the second largest, I suppose, pollutant, if you like, and it's only second to air in terms of premature deaths in Ireland and Europe. That's something not many people know about. The exceedances were mentioned in Dublin, which has triggered an assessment and the need for an air quality action plan in 2021 for all the Dublin local authorities. I suppose in terms of health, it's been well discussed earlier, and from Colm and others, but there is a spectrum in terms of air pollution, from nuisance to harm, and really serious harm leading to death over a period of time. And the WHO has described air pollution as the single biggest environmental health risk. And we haven't mentioned some of the NGOs or voluntary organisations here, and they have a significant role. For example, Asthma Ireland, there's Heart Foundation, there's Cancer Society, and they do have an interest in this. And I just included a screen grab there of the submission from Asthma Society to the last general election. And you can see from the headline, they didn't really pull their punches. They were saying that the health issue is the one that no one is talking about. So no one was talking about it a year and a half ago. Are we talking about it more now than then? So they raised it as a serious issue, but I think it went very much underneath the radar. And just thought I'd maybe look at this in terms of cause, effect, and mitigation. We've looked at traffic emissions so far, as the emissions come from tailpipes. So that's how we understand emissions, but actually there's a very significant portion of emissions that don't come from the tailpipe. They're called non-exhaust emissions, and there's a lot more research taking place at the moment, looking at things like tire and brake wear. And the thinking at the moment is that a large portion of the PM 2.5, that has been mentioned earlier, is actually arising from these non-exhaust emissions. The number of vehicles on our roads has increased dramatically over the last 20 years, doubling in fact. And of course, burning of solid fuels has an impact. So those 3 to me seem to be the largest contributors to air pollution in Ireland. And we need to think about urban areas versus regional areas. Rural towns may be struggling more with burning of solid fuels, but there's been a smoky coal ban in Dublin since 1990. So I find it hard to believe that the main issue in Pearse Street or Philsborough is actually the burning of smoky coal. If we have problems with our air quality, it's more than likely to do with traffic emissions. And if we think about sensory receptors, there's pedestrians, cyclists, residents, all of those different people, but people who have to work in this environment. So traffic wardens, Gardaí, couriers, there's a duty of care there, and something I'm beginning to think more and more about, that we have an issue. If they're out in traffic and they are exposed to these pollutants, an employer at some point is going to have to think carefully about that. And we should also remember that the research is showing that it's not only the people outside the vehicle that are impacted by air pollution from vehicles, people inside are as well, and they're really at the mercy of their filtration systems, whether it's kept clean or not. So people in older vehicles will probably suffer more. The number of premature deaths has been mentioned, but I don't think it has been mentioned. This recent research from last year by the EPA, which looked into deaths from PM 2.5 in Dublin. So there was 725 estimated premature deaths in Dublin, but 144 of those were attributed to PM 2.5, specifically from diesel emissions. So, you know, traffic emissions aren't just about NOx or NO2 and NOx. They actually include these particulate matter, and up to 25% of samples showed PM 2.5 related to diesel emissions. What's really interesting as well, only 50% was related to burning of solid fuels. So it leaves 25% that is something else, and maybe that's the non-exhaust emissions. So what can we do in terms of mitigation? Well, obviously we know about using more sustainable modes of transport. That will help. That will reduce the number of vehicles on the road, number of journeys, and reduce emissions. Looking at policy measures, some that we mentioned already: clean air zones, congestion charges, parking availability, charging for parking, and maybe some or all of those. And I think, you know, we need to be careful when we look at smart mobility options. I think we've seen it from the US. They're banking on technology helping to reduce half of CO2 emissions sometimes in the future, but they don't even know what the technology is yet. So I see smart tech or smart mobility really as tools and not the solutions. And it cannot replace technical or scientific rigor. And I think we need to look at the impacts and how we evaluate the interventions for active travel or any sort of intervention. And key to all this for me is the communication and the public awareness. And Francesco has talked about citizen science initiatives like recount. So just in terms of what we're doing, so for our active school travel route, this is the 25-kilometre network that we're building at the moment. We hope to be on site in June. As we speak, we're planning for the baseline monitoring for traffic of all kinds. That's vehicles, pedestrians, cyclists. But we're also doing baseline monitoring on air, and we're doing modelling for noise as well. So we're going to focus on sensitive locations like outside of schools, residential streets. Using our dynamic model, we'll be looking at before, during the work, and after. And we do feel that you need to allow, you know, a settling in period. There's a lot of, I suppose, upheaval in the first 6 to 12 months of any new scheme, and it's not really a good time to say to make a full evaluation. So you need to let time for these things to bed in. You also have, yes, the other thing is coming up is people say, well, what about the traffic going X, Y, and Z? So you need to have regard for routes that are nearby, just in case there is some element of displacement. We need to look at the evaluation, whether it's not just the health, but social and economic, and think about the co-benefits. So less air pollution also means less noise. It means reduced greenhouse gas emissions. It means improved quality of life. It means you can sit on the side of the street and drink your coffee without belching in fumes. You know, these things matter. And we need to think carefully about communicating changes and data and countering misleading information. It's important not to leave this happen in a vacuum. We need to talk about what's happening, communicate those changes, be positive about the projects. And that'd be my view anyway. And I think over time, we need to develop an evidence base. You know, there's need for further research. We need a better network, a more enhanced network, something we're looking at very closely in DLR, try to link monitoring to mobility and the sensitivity of receptors. So more receptors around schools or in residential streets, or let's say around care homes, for example, if there's a lot of traffic. And there is a role for citizen science. And I think it's really good as an indicator and for engaging people, but it shouldn't replace rigorous and objective evaluation. And just on the communication and public awareness, like I see this as a challenge. So someone like me who's a practitioner is looking to see how can we get this message across that air pollution is obviously a bad thing and it's leading to very poor outcomes in terms of health. It's not visible. The effects are cumulative. We have an issue in terms of engaging the public. They're not really that engaged because it's not something that's urgent as they see it. We need to make the intangible tangible. And this is often remarked on in climate change about making a science fact a social fact. So how do you convert something that's an abstract into something that's relatable? And here's the narrative, like we've been talking about. So air pollution does this, it's primarily about burning of fuels. And logically, we know this is all true. And these are bad things and we need to do something about it. We say the same thing about climate change. Climate change is something we really need to do something about. Our planet's on fire, and it's really kind of a logical argument we're presenting. But what if you look at communication? If you think about really effective communication, it sort of gets more, it gets past a logical point. It actually goes somewhere deeper, somewhere it engages with the person, maybe at an emotional level. And this is where there is a strong role for people in the creative areas, in creative sectors, in advertising or in PR, to put something forward that might be creative, thought-provoking, and impact on behavior. Because really what we're talking about is changing behavior. You know, most people would do the right thing, but they're not really sure they're doing the wrong thing. So they need to be jolted in a sense, you know. And so how would an advertising PR firm address this challenge? It's really interesting. And this has been done. I'm sure some of you or all of you might be aware of this. So you might know of this campaign from the UK. It was sponsored by the Mayor of London, and it's been run by quite a few local authorities there. And it's called the Idling Action Campaign. So it's not an advocacy campaign, it's actually one that's been run through local government and the Mayor's office. So you can see what someone who in advertising has done with this. This is jolting people, this is making you really think about just even leaving your engine idling. In the UK, it's an offence to leave your engine idling. It isn't an offence in Ireland, but obviously it's probably antisocial. It's not helping with in terms of our health. But that's what they present, and those billboard campaigns were carried out through London. We've had some discussions already with the local authorities there, and they're happy for us to use this material. So we're looking at a campaign probably later in the year where we'll use this base material or something similar for an Irish setting. And similarly, you may have seen these. This is it's a Mums for Lungs campaign, I think they're called in the UK. And they put up these posters. And so those set of lungs that are mock-ups there, they actually are impacted by the quality of air. So if it's poor air quality in the area, they actually turn dark. So you have the white lungs, that's the same billboard. And so in Putney in London, very poor air quality, and that was put up as this reminder. So you can see this is having a very profound impact. It's linking in, as I said, at a much more emotional level, but it's actually getting across the same message that the air quality is bad for us. So I think that's the challenge for us, or one of them anyway, in terms of communicating and emphasizing that, I put it this way, creating that link between air pollution and ill health. We have failed to bridge that gap so far. And I think the methods we have used today haven't been hitting home. And for me, we need to look at something that's a little bit more creative, a little bit more profound, and in the end, effective, because we actually want to get behavioral change. So that's all from me. And there's a few of initiatives we've launched in the last week. It's not unrelated because these are actually part of improving air quality. That's what I see Cargo Bikes is about, taking vans and trucks off the road where possible. And what we've launched recently in Capantili is about making that village a little bit more livable, slowing down traffic, removing traffic where possible, and making it just a nice place for people to want to rest and dwell and not a traffic junction. So that's all from me. I think I've run over time, my apologies. So I'll hand you back to Una.
Thanks a million, Robert. As a cargo bike cyclist, I'm delighted to see the word for those traveling and getting more people to give them a go, because they are a significant investment, but certainly for our family, it's been the best thing we've ever bought, and hopefully more businesses and people will see that benefit too. So I'm now going to hand over, and then we're going to go into the old Q&A. So hopefully there's some questions here. If people want to throw some questions into the Q&A section, please do fire ahead. And I am going to, so one was, what software, Emma Byrne asked, what software are we using for this? Now, I'm not entirely sure what this was. So that was at 8:30. That was probably Francesco, I'm guessing.
Okay. That I don't know if the software is related to the platform to see the data.
Probably. Give it a go. Give it a whirl. And Emma, feel free to pitch in if we're not answering your question correctly.
Yeah, well, listen, the data from both sensors is available in real time on web platforms. So the idea is that the citizens can access their own data and the data of the local community in real time whenever it's gathered. So then we are putting together some Excel-based tools to get them also to analyze the traffic data and the air quality data.
Okay. Brilliant. Thanks a million. Now I have a question.
I think actually the time that Emma's question came in, it was in relation to Patrick Kenny and the EPA, but it might have been to do with the modelling. I'm not sure. Thanks.
Patrick, do you want to jump in?
Yeah, the model that you saw me putting up on screen there is part of the ADMS suite of models. It's called Urban ADMS or ADMS Urban. It's the standard model that's used in the UK for all of their urban air quality modeling. The urban version of it is the bells and whistles version of that ADMS suite of models. And we work very closely with an organization called CERC, Cambridge Environmental Research Consultants, who are the people who developed that model in order to run that. If they were asking about Life Emerald, our partner in that is a large Belgian consultancy called Vito, and they are working off another LIFE project, because your European Commission like to see learnings from one LIFE project reapplied at another one, and that's using the Atmosis modeling system. If that was the question that was, or if those were the answers that were being sought.
Great, thanks a million, Patrick. Now I have a question for Robert. To what extent, if any, have you measured schools as trip attractors generators? School staff using cars to work, where they have free parking, family drop-offs on the way to or from work, privately hired buses for schools? That's from Donal O'Brulcon.
Okay. Well, as it happens, we're actually carrying out a school travel survey on Wednesday all across. So, that's part of the Active School Travel project. So every single school, from primary school right through to secondary school, on the morning of Wednesday, they'll have to complete a survey with their teachers, and that survey will be completed and sent in to us. So we'll know on that day how many kids came to school by bike, walking, by car. It could depend on whether it's raining or not on that Wednesday. You know, it's that sensitive to it, but we'll get a good snapshot. And the very interesting point in terms of not how, or around how other people travel to school. So staff, people who are supporting teachers and so on, because I think that is something we really need to have a close look at. It does impact in terms of car parking at schools and the demand on space. But primarily our concern at the moment is looking at how children travel to school, because we need to understand that more. And I think in a different time, we would have been going into the schools, doing workshops with the children, trying to understand it more, but this is the best we can do. And I guess we're also trying to lighten the load on teachers. I'm sure there's a lot going on at the moment. So we'd hope to come back and do this survey after we have the work done, and then see what change has taken place. We'd hope to see an improvement, let's say, in people walking and cycling to school once, you know, after we've carried out the interventions. Hope that answers the question.
Right, I see Cynthia has her hand up and she might want to pitch in on some of the school stuff. Can we make Cynthia a panelist, or is that way too complicated for the tech?
Just give me a second. Yeah.
Okay. Prepare yourself, Cynthia.
Right, yeah.
You should be able to talk now, Cynthia.
Yeah, do you want to just check your microphone there, Cynthia? You should be enabled. Oh well.
Mistake. Okay. I'll boot you off again. So another question from Donal O'Brulcon. Is the UK a good model for measures to enhance health through measures to improve air quality? Are there other examples from smaller countries? The London area has double the population of Republic of Ireland.
I'll take that one if no one else wants to jump in. And I'm going to answer it this way, that yes, we can definitely learn from the UK. I know it's a bigger country. I know it has bigger cities, but the paths that it has looked to forge on actions to improve air quality are things that we can learn from. We can learn from the things that have worked, and we can also learn from the things that haven't worked. And equally, when we look at Europe, again, Europe and the European Commission have done a lot of work on gathering together all of the actions down through the years that member states have looked to use to improve air quality. And again, from the ones that worked very well and the ones that didn't. Equally, as I mentioned, Dublin at the moment is in the process of preparing a air quality plan. The 4 local authorities are working together to do that. And clearly they are going to be looking at best practice measures from other member states and advice from those sort of lists that are compiled by the European Commission. And the last thing I'll say on this as well is, as regards models for measures to enhance health through improving air quality, that we are very, I think, hopefully informed by the Department of the Environment, Climate Action and Communications that a national clean air strategy is expectantly winging its way towards us all within the next month or two. And equally, we would expect that that will also be obviously having measures across the various sources of pollutant on actions to improve air quality.
Are you struggling with my old mute button? So thank you very much for that, Patrick. Now, hang on, sorry. I'm trying to look at questions, look at your lovely faces, all the rest. So a question for Dr. Colm. Interesting point that people should be able to walk to green areas. I noticed that people mostly drive to the big parks near me, Corky, Marley, St. Catherine's, and most people seem fine with that. But perhaps older people are not driving there and so missing out on green areas. So
yeah,
can you talk to us about that piece a little bit more?
Yeah, no, it definitely is an issue, especially older people may not be able to drive or have limited mobility and not be able to walk further distances to get to parks like that. So they probably are missing out. And I think one of the interesting things that some of the interesting photos I've seen out of the coastal mobility route that Robert brought in were people using mobility devices or using wheelchairs to access the coast and to move around Dunleary. I thought actually that was probably maybe one of the most encouraging things that I saw anyway out of that route. Also, things like e-bikes have definitely helped. I have had a lot more people come in over the last year telling me that they're using e-bikes now than before. So certainly, and that these are people in their 70s, 80s, even 90s that I've seen using e-bikes. So things like that definitely enable people to have their own mobility, and I think that's the key thing: is how can we enable the most people to get around under their own steam around our urban areas.
Great. My cargo bike is e-bike. I definitely like the E element when you've got children and a 60-kilo bike. So highly recommend.
As is mine, yeah.
It's brilliant. Also takes plenty of other things, which is fantastic. Now, a question for Patrick Kenny. Get yourself ready. No monitors between the Liffey and Royal Canal save for Ambient Street. Any chance for one at the junction in Phibsborough Village and other busy trafficked areas? That's from Paul Byrne, who I suspect may live around that neck of the woods.
Yeah, I'll take that one, and I think there's one from Kevin Baker a bit further on as well. So I'll take,
thanks.
but and you may want to read that out for the benefit of everyone in a minute. But yeah, on the monitors, we've gone through a major expansion of the amount of monitoring that we have, and we're never going to cover absolutely every junction and every location with the current technology that we have at the moment. But that technology gives high quality, accurate, and very reliable values. This is where we very much see, and it's the European and otherwise practice, this is the role of modelling. And we haven't really had very high quality dynamic modelling in Ireland historically. This is where that nowcast that I was talking about, coming out of that co-funded European project called Life Emerald, is really going to provide, hopefully, huge information for Paul and for others where there isn't a monitoring station sitting at their location. It's going to colour in between the monitoring stations, calibrating itself against the data from where there are monitoring stations and using a modelled product on the hour, every hour, to provide a value as I say, right across the country and at a more granular level in Dublin. Then, and sorry, also to say that also there's an opportunity for Paul, and this is where we are interested in this, and it informs the model. When I mentioned that Clean Air Together project and those 1,200 NO2 tubes going out, like, we do want to know what are the actual values as much as we can right across the city. And that's going to inform the model to ensure that the model is as accurate as it can be. So that's where one of the places where Clean Air Together can provide all this extra information, again, hopefully for the entire citizens of Dublin. And obviously it's a Dublin cycling campaign, but we're going to roll on Clean Air Together, hopefully at other Irish cities down through the years as well. So citizen science and modelling can provide a lot more of this information for all of us. And I do believe into the future, clearly there's a huge role for sensors as well. And we have various interactions there too. Equally, that Google Street Card that we mentioned, that's driving around, and there are some other things that I think are yet to be announced this summer from other third-party private sector companies who we're talking to as well, are also going to provide even more information. So I think in the very near future, we're going to have a lot more air quality information for the entire country, but most certainly for Dublin. And sorry for dwelling on that one too much. On air quality
but
limits,
just so you know, there were people from around the country joined in. So while Dublin Cycling Campaign is hosts, some of our friends from around the country are joining us.
Perfect.
The joys of Zoom.
Okay.
So thanks a million.
Then I can say the next place Clean Air Together is going, it's going to Cork. The plan is that it's going to go to Cork in 2022. Again, look, we just do have to be conscious of where we all will be. We're planning for that. We're planning to put out a similar type study with a smaller number of tubes because it's a smaller urban area, but we're going to go to Cork in 2022. And we have hopes and expectations that funding will continue to us from central government to roll on even further with Clean Air Together and to gain even more information and engage the public even more on all of this. So sorry, on the question on air quality limits, the limit values in the CAFE directive, yes, there are annual values for some of the pollutants, there are daily values, but some of them also have hourly values. So that's on the limits. But the air quality index for health, which is a different product effectively, it is based on hourly values. So it updates on the hour on rolling averages. So it's taking on board the newer information in your local area based on the air quality monitoring station that's in your area. Equally, that nowcast that I was referring to, it's going to color in using the air quality index for health. So it's equally going to be using the latest hourly values in order to feed those through. Equally, on our website for each of those stations, as well as seeing the air quality index for health, it's clickable. You can go in and you can see the dynamic graphs of the data as it's coming through. So if you're interested in seeing, are there spikes around the times that vehicles are at schools, you can go in and take a look at that and see that from the localized stations.
Brilliant. I'm just conscious of time. We have a couple more questions here that I'm going to try and move through quickly. So for another question from Donal, the school survey on Wednesday, is that all primary and secondary schools in Dún Laoghaire, Rathdown, Robert?
Yeah, it's all schools, all primary and secondary, and special needs schools as well. Yeah, so we've issued it to all schools within the county.
Excellent. And does the census gather data on that kind of thing, or is it, or are we kind of stuck at the moment with no data?
Okay, there are a number of different sources of data. Yeah, the census, you could glean a certain amount from it, but that data is quite old now. It's 2016. We've missed a year with the census as well, or we will. So we won't have data maybe till next year. The Bike Life report captures some elements of it, but we're not really getting directly to the school. So this is, and we want to know, see, our active school travel route has actually got specific routes going by schools. So we will be able to compare those schools that have the new routes versus those that don't. So it's a very specific sort of project.
And it's specific to each school then, rather than in the census, it would be to each household and you would know which schools they were going to, I guess.
Yeah, it is. And so we will be able to look at things like gender as well, the impact on gender within the schools. And we also have a more expansive survey that we'll be carrying out. So that'll be more of a qualitative or a survey where we'll be using a professional survey company to understand more about sort of, you know, adults, if you like, as opposed to school children. But I guess the fact that the children are in school, they're there for another number of weeks, it leaves us, you know, it's a good option for us in terms of gathering this data.
Bit of a captive audience.
Exactly, yeah. But they're usually very enthusiastic about it as well. So you're never dragging this kind of information out of them. They're quite happy to offer it.
At some stage over the past year, I was cycling through Ranelagh, I'm not only Rathdown on my cargo bike, and there were kids standing and doing a cycling count, and of course I cycled by my cargo bike and I had to pull up and they all had to have a look, and there was a bit of a debate about was I a motorbike or was I a bike, so I very much pushed them to put me in the bike bracket, but it caused great amusement and probably ruined their numbers. Another question for you, Robert. You mentioned measuring on adjacent street about displacement, possible displacement of traffic. Do you have any results from the Coastal Mobility Project? I know that this is something that we hear anecdotally, but do you have any data and results about how that's impacted other streets?
Yeah, well, we commissioned TU Dublin to do a report. It's not finalized yet, but it's coming close. I'm hoping in the next few weeks, so we'll have more information on that. I think the truth about it is that, you know, there is that element of evaporation, but there's also an element of traffic that's going to find another way. But it's much smaller than what people think. And I think the challenge is that you don't want to create a really messy system of rat run. Sorry, can you hear me okay?
Yeah, we just lost you there momentarily, but you're good now.
Yeah, so sorry. What I was just saying is that we just take care with it, because if we're carrying out some interventions and we think there's a likely rat running route, it's something we would watch very carefully, because we don't want that to sort of have the pushback from a residential community on something that's largely positive. But we would also have regard for it, so we might actually carry out traffic calming on that parallel route at the same time as we carry out the interventions on the main route. So something just to be mindful about. And I think if we're, you know, in time, people understand that there will be an element of traffic settling down, finding a new way. You know, it doesn't all evaporate, but it actually goes somewhere else, and it finds new routes. It goes at different times, and people actually choose different modes. That's what happens. And sometimes when it's a little more difficult to drive, people choose other modes. That's part of the process as well. If it was just as easy to drive, you'd keep driving.
Thanks a million for that. A question for Francesco. Is recount still accepting new citizen sensor hosting applications?
Well,
do you want more people?
Well, at the moment we are focusing on schools, so I'm planning to have the sensors in around 150 schools. So we are mostly looking for schools rather than general public.
And how about schools? If anyone is, I know there are some people connected to schools on the call here. Can they apply to you, or do you have your 150?
Yeah. Just send on an email. I'll even if I have 150, I'll try to find more money for more schools.
Okay, cool, excellent. So another question from Philippe. Are measures to reduce access of internal combustion engine vehicles to the city centres being considered at the moment? I guess that might be for Robert, from you and your local authority sense around the country.
I don't think there are any plans. It's a short answer to that. It's interesting to look across to London, and the re-elected mayor is actually pushing ahead with very ambitious plans for the creation of additional ultra clean air zones. So it is happening in a lot of cities, and of course we know about what's happening in Paris at the moment. So the larger cities are tackling this problem. I think the reason we may tackle vehicles or the city, probably it won't be to do with air quality or air pollution. It'll probably be to control congestion, and it might be more than likely to do with climate action as a response to that. And that goes back to the whole concept of co-benefits. We do it for a particular reason, but there would be another benefit in another area because we've taken that decision. But there are no plans, as far as I'm aware, and maybe more for DCC to comment because they will be ones being most impacted.
We'll get on to them. Patrick, anything do you want to add here?
Yeah, I just wanted to add there that the Department of Transport have commissioned a major study called the 5 Cities Demand Management Study that's ongoing at the moment. It's not finalized yet, but that it's doing exactly, hopefully, what it says on the tin. It's looking at measures to reduce demand management in the 5 cities, 5 main cities in Ireland. So it'll be very interesting to see what the decided final conclusions out of that report are, and no doubt it'll be of great interest to Robert and the other local authorities in Dublin, etc. when it comes out.
Great.
And to all of us.
Yeah, definitely. I have 2 more questions, and I think we're going to wrap it up then, because conscious of everyone's evening. So, Dr. Byrne, there is an under-provision of networks of smaller urban plazas and green space in Dublin, particularly north of the Liffey. Will Irish Doctors for the Environment make a submission to the Dublin City Council draft development plan, or 22 to 28, or if you have not already done it?
I wasn't aware that was open now, but yeah, I'm sure we will. I certainly agree that working and having worked for years in the North Inner City, there definitely is an under provision of green spaces in that area. So yes, we will. Is the short answer.
Another to do. I'm sure you didn't have enough to be doing on your list. Hopefully, someone else can help you. And the final question is from Councillor Carly Bailey, who's from South Dublin County Council. For Francesco, the recount sensors, is that for all of Dublin or Dublin City Council, or is it for the whole country? What's your range?
It's for the whole Ireland. So wherever you have the schools, send them on. I'll take them.
You'll take them. Okay, spread the word. I'm sure our friends in Cork will be straight on this. Now there's a few questions in the chat, I've been told. Janie, I have to jump everywhere. Is idling action legislation due here? Does anyone know anything about that?
It was suggested a number of years ago, and I think the view at the moment is that it would be better to have some form of public awareness campaign, and that would be my view, rather than to have legislation. I think even if the legislation was in place, someone's going to have to enforce it, and I can see that's a very difficult law to enforce. So I think public awareness would be a better approach, in my view.
I see there's Lorraine Darcy, who's Dr. Lorraine Darcy from TU Dublin, is here on the call. I don't know if you're still there, Lorraine. You pitched into the panelists about permeability and its impact of accessing green spaces. If Lorraine is willing, do you want to jump in and say a few words? Putting you on the spot, hun. Lorraine is a friend of mine, okay? I'm not just totally grabbing a randomer.
Hi, can you hear me?
Yeah, all good.
Okay, cool. No, I was just commenting on, there was a mention of access to parks, and this is something that we see right throughout Dublin, is that, and all over the country actually, that we've invested a lot in making our parks really walkable spaces within them. And what we haven't really done very well is actually connect the arms of the park out and linking kind of more walkable and cyclable routes out into the into the neighborhoods around it and into the connecting villages. So what we're seeing as a result is that, even families that live relatively nearby are still even driving to the parks rather than walking, particularly if you've got small kids and there's no road crossings or narrow footpaths in the area. So that's something that we really need to do, is actually to look at the networks outward from our parks and other recreational amenities. So that's what I was just pitching in with.
Thanks, Lorraine. Sorry for putting you on the spot.
No worries. I'll get you back.
So with that now, are there any other questions that I've missed to my wonderful assistants who are keeping an eye on the chat?
Kevin Baker just had an observation, and then there was a question from Peter Brannigan, and there was a question somewhere else from Niall Byrne as well.
Yeah.
And the other thing is, somebody's looking for Francesco's email address.
I've
been
put
shared
that
already.
into the chat there.
That's
Yeah.
on, is it? Okay, great, thanks.
And I just have one other question that I've spotted here for Robert, which I think you could probably go on for a while. How did the coastal mobility route get through relatively easily in Rathdown when Saint-Germain has been such a massive issue? As you know, I live really close to there, so I'm very interested in how we can sort this out down at Strand Road.
I suppose the simple answer to it didn't get through easily in DLR either, but it got through. We had to work hard to get that route through, and there was a lot of engagement along the way, and our staff were really excellent, and we're very lucky that we have very skilled staff that pushed ahead and got it done. I guess it was timing as well. We did that. We started that work last July. I don't think it was, maybe it was more difficult for Dublin after that. None of these projects are easy. I haven't come across an easy one. If it was easy, it would have been done 30 years ago when it was first suggested. So,
well, as someone who's cycled with her kids all the way down the coastal route and loved it, we've done it multiple times. Thank you. It's really made an impact to our families' lives, and I'm sure to plenty of other people who are on mute here. So thank you. We share that appreciation. Now, I think that's us on the questions. I'm conscious we've run quite late, but great to see such wonderful engagement this evening. We'd like to invite those of you who'd like to join us for a virtual pint. This is the bit where we normally go to the bar and have a natter to join us. We can invite you all as panelists. If you want to scoot off, that's also cool. We are very happy to have a few people around. Just to remind people, our next talk will be on cycling holidays in Ireland in the middle of June. So come along to that, and we'll be making this recording available on our YouTube channel in the next couple of days. I'm going to suggest that we stop recording now so that we